And again, welcome everyone. Good afternoon. We are back from the technical break for the second to last session of this second day of the Digital Health Society Summit. Today, we're connecting the dots between the innovation, knowledge, and our communities. And in this short half an hour session, we will zoom in to the communities. We will zoom into the global community of ECHAlliance ecosystems and Thematic Innovation Ecosystems. And there is also, this will culminate with the launch of the Health Data Thematic Innovation Ecosystem. So let me welcome now two of my colleagues that you already know from yesterday and today, Bleddyn Rees, who is the chair of the Digital Health Society, and Andy Bleaden, who is the community director at the ECHAlliance. So back to you, Bleddyn and Andy.
So hello again, and I'm not Andy Bleaden. He's the guy in the suit in the other square. So Andy, hi. Let's start about how ecosystems actually start. What's involved in setting one up?
Excellent. Thanks for that, Bleddyn. I think this session, I kind of thought we need to have someone uses the term quite often, a so what session. So what are we doing next? And I think for us as the European Connected Health Alliance, that's about looking back and looking forward at the same time. So we've seen a growth in our network and our community. So we've seen a growth in our membership, and we're a member organisation. So that's always vital to understand. A growth in our membership because of the pandemic and during the pandemic, in a way that we couldn't have forecast before, as more people understand the need to connect the dots, as we like to say. So we've seen a growth in that, where we've now got over 900 member organisations, most of which are public not-for-profit government bodies, about 120 odd hospitals, 270 academic organisations, 80 patient groups, 120 government agencies. What that means is we can then pull on those networks and those connections back into our ecosystems in a way that we couldn't have done before, because that network's grown. Not just across the UK, not just across Europe, but globally. We'll go back to where we started earlier on in the session before, to look at those ecosystems a little bit more in terms of how they've grown. We've used that gap that we've had with the pandemic to be able to virtually continue matching need and solution, bringing together those ecosystem stakeholders, still leading with a need, still driving with our patient organisations, bringing up what the need is in our ecosystems, whether it be COVID related or non-COVID related issues. We're still seeing, because of the delays we've seen in various countries, the need to increase the amount of work we do to break down some of those silos that have been smashed open, to see legislative changes to ensure that telehealth and e-health can actually take part. We've seen some transformational areas within our ecosystems as that network's grown in ways we couldn't have forecasted before. And here's the nub. What that brings with it is even greater economic opportunity within those ecosystems. Because as I said earlier on in the session, if you were at the session with our other ecosystems, we've got that ecosystem network that's grown to launch our 70th ecosystem. Now, let's just turn the clocks back. When we did our first Digital Health Society Summit in Finland, I picked up a leaflet we had at the time. We had then in our network a really strong basis of 40 ecosystems, just welcoming in 6 from Finland during the presidency of Finland of the EU. But since then, and we're only talking a couple of years, that ecosystem network has grown. Grown that we've now, as I said, grown to have over 70 ecosystems, but grown as well with the opportunities we've had because of virtual working to open up ecosystems where we couldn't have dreamed of before. In Argentina, where we're working really closely with our Argentinian ecosystem partners there. Within Chile, a country we couldn't have dreamt of having the connections with before. But because of our own networks and connections, we've been able to build up trusted relationships with reliable partners, central government partners in Chile, for instance, to help create a brand new ecosystem there. Yeah, in Canada, we've been able to open up as well.
And I think that for those people who are listening out there who aren't actually currently involved in an ecosystem, I can remember when we only had 4. And at the time we were thinking, well, getting more across international borders might be a challenge because healthcare systems are structured so differently from country to country, funded so differently. But actually, as time went by, we began to realize that actually these regions and countries had much more in common than they had differences. And that the key to this is that we're not prescriptive, are we, about how they structure their ecosystems?
No.
So they can be very diversely organized to suit the particular requirements of a region or a country. And I think in your previous panel where you had a number of our ecosystems presenting, that was obvious that they don't all look the same. And we don't worry about that, because what we're really interested in is that they have common needs to collaborate together to actually improve and meet those needs.
I think that nails it, because you've got that with I'll pick another ecosystem there within Australia. A fantastic ecosystem, couldn't be further away from us, but yet they're driving much of the collaboration that exists within our network because of their connections both within Europe and outside of Europe. And I think there's a very different style of ecosystem. And I think as we welcomed different countries and different continents in to that network, that's grown not just the size of the network, it's not about having numbers, but the quality of those connections, because the ways that you can, as you say, see the similarities as opposed to the differences. Because the first question we always hear is, how can we do this? Because we're different. It's a different setup in this country. Well, that's the same for all of those countries, whether it be Sri Lanka or in Sweden, or whether it's with the Eurosanta ecosystem featured earlier on, or Croatia. That's the benefit, and that's where collaboration really starts to pay off. So we're seeing collaboration in our ecosystems now baked in. So we have created in the last year, because of that level of willingness to collaborate, what we've developed a new series of what we call Thematic Innovation Ecosystems. Okay, so that's where our ecosystems are in the driving seat, and we've listened to them in terms of both what they need in terms of ability to be able to collaborate, and what they've said to us is we can collaborate on a project by project basis, but we've got particular interest in our ecosystem on mental health or on digital health and well-being. But we want to go on a deeper dive, but also collaborate each time and bring in ecosystems. So those thematic ecosystems we've brought in have been able to, I think, bring about a step change in the level of collaboration. So certainly the last 12 months, not even 12 months, we've worked with colleagues from Scotland to set up 2 thematic ecosystems, one on integrated care, which is top priority for many countries, and one on digital health and well-being, to showcase both how they've reacted against COVID, but also where that's impacted on policy, where that's actually made that so what question happen. So we've got a pilot, what happens afterwards? That's brought in best practice from all their partners and all their collaboration networks as well, whether it's across Europe or beyond. On a topic like mental health, we've seen ecosystems from Germany and Norway step up and say, well, we'll lead that because we want to go deeper down and target on a subtopic basis, isolation, acute adolescent mental health issues, self-harm, substance misuse. So we can go topic by topic on a cross-border basis. That helps us then both showcase need and best practice from different countries, and I'll tell you about how that works in a second, but also enables further collaboration, whether it's with projects or pieces of work between governments. I'll give you one practical example of that. So within the mental health ecosystem, I could showcase best practice from Quebec, from Finland, from Norway, from Germany, from Denmark, from the Highlands and Islands of Scotland, in a way that I couldn't have done before, because we can do that virtually in a way that's beneficial for our ecosystems. And conversely, and then this is another example where we've been able to connect up an ecosystem from Australia with one from Denmark around the field of skills for health, we've been able to look at skills for carers. We touched on this earlier on with some of our projects. Skills for carers, skills for professionals, and skills for unpaid carers. So that's an example of where we've built, I think, a new level of offer for our ecosystems to collaborate together. What that's helped us to do is bring in some of our partners and our members. So we're seeing partners and members getting involved in the housing and health ecosystem that we would not necessarily be able to do because of geographical boundaries before. So the Finns at VTT have stepped up to assist the work of our Italian Treviso ecosystem around the field of housing and health. We've got health procurement being seen as a key issue. We talked about that earlier on with our ecosystem in Helsinki. But again, we've got partners who want to lead on looking at health procurement, whether it's to do with government procurement of health, SMEs involvement, sustainable procurement. So there's a number of opportunities we've pursued, and we've got an ability now to be able to grow that in the future. We'll come on to that in a moment.
So I think it's worth just pausing there for a second. So what you're doing is you're creating opportunities for research institutes, university who've got knowledge and research to be able to make that available outside of their particular region or country, so that we avoid reinventing the wheel in different places around our network. But also we're creating opportunities for the organizations perhaps to be involved in projects where they're getting some funding, or to get involved in selling some services, or making links with people where they can test innovation. So Vodafone this morning we're talking about being able to deploy innovative solutions. So actually there's something in this for potentially all sorts of different categories of members and for organizations.
I think just on that one, you've got the potential here, because we've started to build with the Global Health Connect partnership that we heard from yesterday, links outside of Europe. We can bring in, we'll talk later on about the digital health data side, but we've had very keen interest to build new thematic ecosystems around areas that have been areas we've not targeted before. But because we can host and build that repository and share those funding opportunities, we can target areas we couldn't have done before, whether it's social determinants of health. We're looking to partner with colleagues from America in the future, whether it's the whole field of subtopics around health and gender.
And I think it's worth perhaps explaining to people, and perhaps an idea that I've taken to you very recently. So a friend of mine has suffered from some menopause problems and started to talk to me about how poor the services were where she lives in Wales. And I then reached out to you and said, across our ecosystems, is menopause something that lots of ecosystems either have as a challenge or they have as an area of expertise? And then you started talking to me about, well, is this a wider women's health issue, or is it a gender health issue, so that it's not just women, it's also men's health, and what are the specialties? And that perhaps gives people a flavor for how we start to develop some of these things. It could be as simple as a conversation that one of us has, and then we're reaching into the ecosystems to find out, is this something they have expertise on? Is this a problem for them? And in the same way, then you're able, through the coordinators, to deep dive into areas of expertise and or challenge, and then try to proactively involve a number of the ecosystems who think, actually, that's really interesting for us. We do like the mental health thematic ecosystem, or we do have problems with health procurement. Yeah, we would like to work with other ecosystems to improve the position. So it becomes mutually reinforcing.
Yeah. Well, and I think that needs-led approach is one we've seen on whether it's to do with health and gender, or even on the area of continence care. Because again, there's a whole range of topics to cover, which is a patient-led. One of our patient groups that we work with, WFIPP, have said to us that this is a real issue cross-border, and they talk about the need within that, whether it's to do with stigma or youth, or to do with education, digital solutions. A whole new area for us to look at as a potential thematic ecosystem. And to bring in that best practice, cross-border best practice that we can do because of that connectivity, because of that network, in a way that we couldn't have done perhaps before. And utilise, again, their connectivity as well as ours to add value. Because why would we want to reinvent the wheel, as you said before?
Yeah, and I really like the way that you've been able to adapt the network and the way it works as a consequence of the pandemic, because our traditional model was physical meetings where people would go from one ecosystem to another, which was, in sometimes could be relatively easy travel between, let's say, some of the Nordic countries or inside the devolved administrations of the UK. But in other cases, it's long journeys. But now the beauty of, if you like, the digital virtual meetings, like our conference today, is that we can have people join and they haven't had to travel, they haven't incurred the cost, yet the value from exchanging information and participating is all still realized. And I'm conscious that this is perhaps where the South American ecosystems really benefit. And despite the time zone differences, we're able to actually convene groups of ecosystems which are even richer as a result in terms of their experience and knowledge.
Absolutely. And I think, just in less than just over a week's time, we'll be bringing together our ecosystems from Chile, Canada, Argentina, and showcasing them to our European ecosystems in a way we couldn't have done before.
Yeah, and I think for people listening again, nobody has a monopoly of innovation. Nobody has a monopoly of good ideas. And the strength of the network is that we can often find expertise, some brilliant services that have been developed in what some people might regard as unusual locations. And that's the strength, isn't it, of being able to spread that knowledge and make those links and connect those dots.
I think that's the value of an ecosystem. That we've seen that within the pandemic, from utilising innovation within Scotland, and seeing Australia take an interest in that as a remote video conferencing, and then realising it was actually an Australian concept built within the same ecosystem. So we've been able to maximise those ability to be able to break down some of those silos we've heard about before.
So Andy, we've had a question from Paula Lopez who says, I'd like to know who decides the focus for these thematic innovation ecosystems.
That's easy, not me. So that's good. It's down to our ecosystems. So those topics, for instance, within the mental health ecosystem were chosen by the leads from Rhineland-Bonn and the Norwegian Smart Care Cluster. Down to them. It's the stakeholders who decide the topics within those ecosystems.
So I think it's fair to say that initially it's the ecosystems who decide whether a particular topic is the right topic and they're interested in it. And from our perspective, we need a critical mass of them to decide. So we don't need 70 to decide, but we might need 5 or 10. And then within that theme, so let's say it's mental health, as you were just pointing out, the individual deep dives within mental health are then decided by the group that have come together to form the thematic ecosystem. So Paula, it's very democratic.
I think the idea is we can't, as you said, we can't control it. So we threw this back to our ecosystem coordinators back at the start of the year and said, what's your top priority? And the top priority was digital skills. So that's the one we started first. Then it was mental health. Then it was integrated. Because otherwise, we're quite a small organisation in terms of our size, but our network have got that strength. They understand that local pressing issue, that regional or national issue that we can't necessarily. And they can do what we can't do, which is bring their need, their solution across.
And I think that there were a couple of great panels this morning about how culture affects the adoption of digital health and tools. And then we had another one that was very much looking at what are the digital skills that are missing. And then, so Rachel was, we've got a skills thematic ecosystem, but it's interesting that we're starting to hear that the traditional focus has been very much healthcare professionals. And what we've heard this afternoon and this morning was, well, actually, there's a need for patient digital skills. There's a need for citizen digital skills. and digital health skills of both of them.
Yeah.
And that's where the thematic thematic ecosystems can be adapted and expanded in terms of what they're covering.
And it's important. It's important to do. And I think with the skills, just on that starts off first with carers, unpaid carers first, because they're ignored always when it comes to skills development. Then professionals, and then other people. So start with the area of need that's the largest within the ecosystem. And again, it'll be the same with our digital health data ecosystem.
And it struck me just before we talk about the health data one that this morning we heard from some of the academic points around the key features of training, and so there's all this knowledge that's untapped that we can disseminate and make available to other systems that are having those challenges.
Yeah, and I think the case in point was the Skills for Health one, where we had an expert from Denmark, South Denmark, who can assess people's skills needs and came up with tools to actually do that assessment. That's quite rare. So we can present that as a solution then for other ecosystems to match and to adopt. So that was expertise in South Denmark that came out directly as a result of how do you actually assess where people's skills are up to.
So Paul has come back and said, also, if we have an idea for a thematic area, what do we do next to get it started? Do we need to be an ECHAlliance ecosystem first?
No, we've been quite clear with that. We're working with our ecosystems primarily because they've got those connectivity, those connections deep down. But you'll see with the ideas we've got relating to continence or probably social determinants of care and around also with health data, that we've got that ability to be able to bring in our partners, whether from Finland or from the US around health determinants, to help us build that ecosystem.
So I think the answer for Paula is she should get in touch with you.
And obviously there's an email address here, and come and have a chat with me, because this is a conversation we've started with many of our ecosystems and partners. But come and have a chat with us with some ideas. But just come with an idea of what potentially those needs could be.
Okay, should we move then on to the Health Data Thematic Innovation Ecosystem, which we're launching unofficially today?
Yes, please. Yeah. So the
Thank
idea
you.
behind this is part of that idea of the work we've done with the Digital Health Society. But Bleddyn, I think you've got some ideas about this as well.
Yeah. So I think that yesterday, for those of you who are able to attend, you'll have heard about the roundtable work that we've been doing, deep diving into digital and data challenges in the context of the European health data space. But what we realized was that there was a need to inform and provide information and guidance and develop this whole area. And it's great to publish papers and thought leadership, but the whole virtue and benefit of the ecosystems is to do stuff, not just talk about it. So it made sense to have, as Andy and his colleagues developed these thematic ecosystems, to create one for health data. And you can see under the subtopics in the blue box that obvious areas were health data, cybersecurity, data governance, and global health data. And we've got involvement already in a number of EU projects where aspects of these are very relevant. So data governance, and you heard today around a couple of the projects, whether it was Gatekeeper or others, of how they're working in this whole area. So there's an obvious bedrock of activity within the network to build on a health data ecosystem. And one of the things we'd like to do today is to encourage anybody in the existing ecosystems or any of our members or other people who are attending today, if you have a real interest in this and you think you can put your shoulder to the wheel, if you like, get in the trenches with us and help us progress this, then please contact Andy and we'll be very happy to hear from you.
Thanks for that. And I think, I'm always open to new ideas on these, because we've got to keep these ideas moving because we've got so many of these dots to connect around our ecosystems. And I think, the health data one is a case in point. So I think that's hopefully a lasting legacy from today and yesterday's session, as we can build upon that and create that thematic ecosystem. But it doesn't have to be those subtopics. If you think actually, no, cybersecurity is much more important than healthcare data, come and tell me about it, because we're interested to get you involved and feature not just your ideas, but your need and solution, because that's what these are about, leading with the need and then trying to match those solutions as well.
And I think a final sort of topic for us to just quickly discuss is the sort of services that the ECHAlliance provides and between ecosystems. So I was thinking about you could say something about some of the trade missions and then the consortium bidding.
Yeah, we've done some really exciting work for both on trade and like a virtual trade mission, but also face-to-face trade missions, where we work with our key leads on this, within the Galician ecosystem, who do this all the time and do trade missions between whether it's Spain and Serbia, or Slovenia, or the Netherlands, or Poland, or China, or Israel. They get that idea of matching need and solution across border. And that's given us a great opportunity to be able to share that facility with the rest of our ecosystem network. So we're seeing hopefully some more of these launching in the future, whether it's between Estonia or Slovenia, or Germany and other countries too. On the project side, what we've seen is some great opportunities for our ecosystems to get stuck in to the projects that we're working in. So it's no coincidence now that we've got a really strong innovation team that build in and bake in our ecosystems into our projects, because why wouldn't we? They're bringing both, whether it's the need side or solution side, into those European funding programs, those global funding programs. So there's a number of opportunities to connect the dots up between our ecosystems and funders, or our ecosystems and other clusters. So you've seen some great examples today, hopefully, of ecosystems that do that connect up the dots, that
Brilliant.
Connect up our members too.
And I think with that, Andy, we're going to close. And I think
Brilliant.
The final thing I'm going to say is, if you're not an ECHAlliance member, please join.
Yeah. We'll put a link in the chat function for you now.
Thank you very much.